Hi, and welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz, PharmD, also known as the Thyroid Pharmacist. Today, we're going to be talking about whether nutrition and diet plays a role in healing from Hashimoto's, and spoiler alert, it does. We're going to be talking about what diet can do and what diet cannot do for us. So stay tuned. So let's jump into this conversation, and if you're just dialing in for the first time, my expertise from Hashimoto's really came not from going to pharmacy school and getting my doctorate degree in pharmacy, but from being a Hashimoto's patient. In 2009, after almost a decade of some strange symptoms, I was finally diagnosed with Hashimoto's, and I was working as a pharmacist, working with people with various health challenges and developmental conditions that perhaps didn't have a standard of care approach to their health. And so I got really good at research and researching various studies into interventions that might work for my clients. And I got into patient forums, trying to figure out what might work for my clients. Usually it was parents of the clients with rare genetic disorders talking about, will this intervention help? Will this intervention help? And so when I was diagnosed with Hashimoto's, I thought I was leading a very healthy lifestyle. I was exercising. I was eating whole wheat and low-fat dairy. I was starting each day with whey protein shakes with Greek yogurt. And I was eating a cheese and turkey melt with a croissant or something similar for lunch, right? And I was constantly exhausted. I would sleep for 12 hours plus a night, and I had acid reflux pretty much all day and night. I had carpal tunnel in both arms. These were going on for about 2 and 3 years. And I also had irritable bowel syndrome, which had been going on for, I want to say, since 2002, and a whole host of symptoms like anxiety and hair loss. Fast forward to 2011, it's New Year's Eve, and I decide I'm really going to take charge of my own health. I'm going to figure out this Hashimoto's thing. I'm either going to get this Hashimoto's into remission, or I'm going to be the healthiest person with Hashimoto's. And what I actually did is I took a food sensitivity test. I had heard about the gluten-free and dairy-free diet sometimes helping people with autoimmunity. I had seen a study about the gluten-free diet helping people with celiac who also had Hashimoto's normalize their Hashimoto's antibodies and their thyroid function by going gluten-free. I had heard some information from integrative doctors on the interwebs about going gluten-free and dairy-free, but for whatever reason, I needed to see it on paper. And so I got a food sensitivity test that showed I was gluten and dairy sensitive from my integrative doctor in Chicago. I went and I saw this test and I was like, okay, this is going to be my last hurrah. And I went to an all-you-can-eat Polish buffet. So I had pierogi and Polish bread and all kinds of dishes that were very rich in gluten and dairy. And I was like, this is going to be my last weekend. And I remember feeling at that end of that weekend, I was in so much pain. I was bloated, my stomach hurt, acid reflux, my joint pain was acting up. I had diarrhea and all kinds of digestive distress. And then I was like, I'm just going to do this diet. I'm going to do it right. I'm going to do it for 3 days. And just to prove that it didn't work, right? I was very skeptical of how that diet would actually work. And I kid you not, within 3 days, I was so much less bloated. I was always accused of being pregnant by various people. And I went to Pilates and workouts and had a bit of a belly, constantly bloated. And then all of a sudden, my belly started getting flat. And I was like, oh, wow, you can actually see my stomach muscles. That's never really happened before. My acid reflux. So at the time I was taking Pepcid and I had tried proton pump inhibitors. They did not work well for me. I tried a few different ones, months on and months off. I ended up taking Pepcid, and Tums. I had this big bottle of Tums that I carried around me everywhere. And I was also drinking Yogi's ginger tea, which quite frankly was one of the more helpful things for acid reflux that I had found. But I was still symptomatic multiple times per day and was reaching for those Tums like every few hours. And so by that third day of eliminating gluten and dairy, I was like, wait a minute, like I don't think my acid reflux is there anymore. And then the diarrhea and the digestive distress, that went away, and my stomach pains went away. I was like, I just thought it was a normal part of digestion that your stomach would hurt. And 2 weeks later, I also started researching carpal tunnel, and I took a B6 version, vitamin B6 to help reduce carpal tunnel, and did some chiropractic adjustments. And the carpal tunnel was gone in 2 weeks. So 3 days to get that irritable bowel syndrome and acid reflux, bloating, stomach pains, to get those into remission after having them for, 3 to 7 years, maybe even longer at that point. And then the carpal tunnel took 2 weeks to get rid of. And I had that for like 2 to 3 years. I had been using like the Dragon dictation software at work because I couldn't type. The carpal tunnel pain was so severe, and I had to wear arm braces at nighttime. I had to take tons of ibuprofen around the clock to try to mitigate the pain. And so at that point, I was like, wow, this is quite impactful. And I just really need to mention, I did not have celiac disease. So I was tested for celiac disease and I did not have it. And actually that test kind of delayed my time to actually, trying the diet. Cause I was like, I went to my endocrinologist and I said, what if can diet make a difference in Hashimoto's? And I showed him that study with celiac disease. And so he tested me and said, you don't have celiac disease. You do not have to worry about being gluten-free. And fast forward, I got myself into remission. Diet was definitely a great place where I started, and it's a great place for most people to start. And in these times, in my experience in people with Hashimoto's, about 88% of them feel better gluten-free, and about 80% of them feel better dairy-free. One of the theories as to why gluten is so reactive in people with Hashimoto's, even when they don't have celiac disease, and of course being mindful of the fact that more people with Hashimoto's are going to have celiac disease than people in the average population, and more people with celiac disease are going to have Hashimoto's, vice versa, but it's still not 100%. It's something like maybe 10%, right? And so gluten, or more specifically the protein gliadin without gluten, mimics the structure of the thyroid. And so the body starts an attack on the thyroid as well whenever we have gluten and it leaks into our bloodstream, maybe perhaps through intestinal permeability in the gut. So this is one potential reason why people might react to gluten outside of celiac disease. It could also be because of SIBO, and gluten is a type of food that can be reactive very much in SIBO. It's one of the FODMAPs. There could be reasons why perhaps if it's not organic wheat, if it's been sprayed with glyphosate, some people report that's the reason they're reacting to it. And then there's also something known as non-celiac gluten sensitivity. So nonetheless, there are many different pathways to having a reaction with gluten when you have Hashimoto's. And interestingly, the symptoms that a lot of times people will report are going to be gut symptoms like I had, such as constipation, diarrhea, cramping, bloating, nausea, gas, acid reflux, burning, or burping. And these symptoms will oftentimes go away on a gluten-free diet for people with Hashimoto's. And then there's also some brain-related symptoms. These weren't as relevant for me, but I know a lot of the people that I've worked with will definitely say like the brain symptoms were the worst for me. So headaches, dizziness, brain fog, anxiety, depression, fatigue, and insomnia, as well as like joint pain is another big place that I see gluten making an impact. Furthermore, some people might see a reduction in thyroid antibodies. I've also seen some people eliminate thyroid antibodies completely, and I've also seen some people normalize their thyroid function completely. Initially, I came across a study of people with celiac disease when they were undiagnosed with celiac and they had Hashimoto's. Some of them were able to get into remission once they went gluten-free. I wish this happened for every single person that goes gluten-free. Unfortunately, it does not. Now, back in the day, doctors would say you do not need to go gluten-free if you have Hashimoto's. I feel like now it's a more accepted fact that in the surveys I've done with my clients and my readers, people will say that they had a reduction in thyroid antibodies, that they had more energy. About 67% of people will have more energy, better mood in about 60% of people, and about half of the people will have a healthier weight. So if they were underweight, they can put on better weight, right? Probably less gut inflammation. And if they were overweight, they can also get to a healthier weight. So one person that wrote in to me said gluten elimination was the first thing I did. I lost 8 pounds in 2 weeks without dieting. I added supplements, exercise, and cut out sugar. I'm still losing weight and cannot believe how good I feel. It was really, really interesting. I did a survey of over 2,000 people with Hashimoto's about 10 years ago. And a lot of times people were saying that the gluten-free diet, they had better outcomes on that than they did on like thyroid medications. And, being a pharmacist, I don't take that kind of thing lightly, but this could be a really, really powerful intervention. I spoke at a functional medicine conference in Poland. It was one of the first ones in 2017. And I had the honor and pleasure of being there and speaking about the gluten-free diet in Hashimoto's. And I was really excited to see there was a study done in 2019 by Dr. Robert Krysiak and colleagues from the Department of Internal Medicine and Clinical Pharmacology at the Medical University of Silesia in Katowice. They published an article about the benefits of the gluten-free diet in Hashimoto's. So what they found is with 34 women with autoimmune thyroiditis were split up into 2 groups, where one group followed a gluten-free diet for 6 months and the other one followed a regular diet. After 6 months, the group without dietary treatment had thyroid hormone levels similar to what they did at the start, but then the group that went on the gluten-free diet showed significantly reduced levels of thyroid peroxidase and thyroglobulin antibodies. So this is a small study, and there's been other studies out there that have been conflicting as well. But just in my observations, honestly, so many people feel better gluten-free that it's just worth it for you to try that if you're not already gluten-free. The second biggest intervention that I recommend is the dairy-free diet. Interestingly, this is probably the second biggest impactful thing. About 80% of people feel better dairy-free. So 79% to be exact in my survey. Some of the things that improve include mood, energy, weight, skin, and pain. For me personally, that carpal tunnel was such a significant symptom, and dairy-free, I think lowering my overall inflammation helped me get rid of carpal tunnel. And interestingly, every time I had dairy, whether accidentally or on purpose, for many years after that, I started getting carpal tunnel symptoms again. So some people really feel that this is a really big game changer for them. I oftentimes get the questions of, is this going to be forever? How do I give up cheese? Does goat's milk work? Can I do butter? Can I do ghee? And it's very hard for many people to part ways with dairy. Interestingly, that there are proteins in dairy similar to morphine. They're known as casomorphines, and they actually help make you like somewhat addictive to dairy. And another question I get is lactose-free dairy. Can I just have lactose-free dairy? So it's actually true that many people with gluten sensitivity, celiac disease are going to have an issue with their lactase enzymes. So they're not going to be able to digest lactose properly. And that can cause a lot of symptoms like irritable bowel syndrome, symptoms, digestive symptoms, but it's not just lactose in dairy that can be problematic. So I have seen people react to the whey protein in dairy, the casein protein in dairy, and then some people also react to milk fats, so even butter and ghee. So for most people, what I recommend is going on an elimination diet of these two foods for at least 21 to 30 days and seeing if you feel better, if you have less inflammation in your body. You can consider reintroducing the foods after that time to see if you get a reaction. Generally speaking, you'll see the reaction within 3 to 4 days. You might not see it right away. Some people do see it within minutes. For some people, it takes 3 to 4 days to see a reaction. For example, they might have gluten on Sunday and on Tuesday, they'll get a migraine, right? So this is something that I feel like is a really great place for most people to start. Unfortunately, goat's milk, raw milk, all of these things are going to be cross-reactive if you're dairy sensitive, especially to casein. Whey protein powders, which are amazing in so many ways, and Greek yogurt, these can also be reactive for you. Now, I will say that in my experience, you can bring dairy back. I didn't think it was possible for many years, but I figured out how to do so. I'll do a specific podcast on healing from food sensitivities. I actually wrote about it in my upcoming book, The Root Cause of IBS. There are methods that I found that work really, really well. And so I'm excited to share that with you. But oftentimes we do need to start with that elimination diet to get the source of inflammation out of our system. But we can, within a few months, sometimes longer, sometimes shorter, get that immune tolerance back so that we're able to tolerate a lot more foods. So gluten and dairy-free is a great place to start. You can just take them out of your diet if you prefer. You can also do a food sensitivity test. A lot of times I will have people who will bring me food sensitivity tests and they'll say, look, I'm not sensitive to anything, or look, I'm sensitive to everything. And the tricky part is food sensitivity tests are not all created equally. So for example, there are tests that your allergist can do on your skin that test your IgE, or they can test it in your blood. And these are things that are anaphylactic reactions to things like peanuts, right? And so generally speaking, you would know if you needed to go to the emergency room or use an EpiPen after an exposure to this kind of food. This is not the same kind of reactions that people with Hashimoto's have. People with Hashimoto's tend to have something known as a delayed type hypersensitivity, and that's usually through the IgG branch of the immune system. So you need not an IgE test, which you'll get from an allergist, immunologist, but you need an IgG test. And these tests are actually done through some immunologists and some integrative doctors. And sometimes you can self-order them online, and there's so many of them on the market, but they're not standardized. So some tests use cooked foods, other tests use raw foods, and the way that they expose our blood to them might vary. And I haven't been able to necessarily correlate symptoms with most tests on the market. The only test that I swear by is Alletess. It's ALLETESS. And I'm going to put a link to Rupa Labs on how you can self-order that. This test, I can track for the last 10 years. If somebody's food comes up reactive, they're going to react to that food. And they're going to have symptoms, acid reflux, digestive symptoms, all kinds of weird symptoms go away when you eliminate the food that's actually reactive. I know some healthcare professionals, it's kind of a controversial thing these days. They'll say food sensitivity tests are not worth it. They don't work. And then I'll ask them which food sensitivity tests they've used. And of course, the ones that swear by it know about Alletess and they use it. And then the ones that are like, oh no, this doesn't track, this doesn't correlate. Oftentimes it's because they're using other tests on the market. And I'm not affiliated with the company. I do have self-order links and so on and so forth. I've just been using it for many, many years with myself personally, with my family members, with my clients. And I just have seen it to be a really big game changer for people in figuring out what they're sensitive to. If you're somebody like me that needs to see it on paper, that might be something worth investing in. Otherwise, you can just eliminate foods on your own. I will say in some cases, if you're just not sure, what you're sensitive to. Maybe you've gone gluten and dairy free, but you're still having digestive symptoms. That can help dial things in. I know I've seen some really random things pop up for people, whether that's like pineapples causing acid reflux, ginger causing acid reflux, nuts causing skin breakouts, so on and so forth. These are some of the nuances and random things the test can catch. Sometimes it can help us dial things in. Beyond food sensitivity testing and eliminating gluten and dairy, one of the other key components of what I like to really focus on is blood sugar balance when a person has Hashimoto's. And this really focuses on, if you're starting with a standard American diet, we're going to be focused on eating more protein and fat, and generally speaking, lower carbs to help balance your blood sugar. This oftentimes helps with symptoms like anxiety and brain fog and fatigue, and it also helps to stabilize thyroid antibodies. It's also a really, really great, helpful tool for weight loss. So blood sugar balance can be a really, really big game changer if you are trying to lose weight, which many people with Hashimoto's, this is one of the key symptoms that people complain about. If you're new to Hashimoto's, diet is a really great place to start. I will say people do significantly feel better, but it's also not the be-all, end-all. There might be other things you might need to do when you have Hashimoto's. So for example, you might need to address nutrient deficiencies. You might need to address gut infections. You might need to address your stress response. You might need to address your detox pathways. And sometimes I see people getting into trouble, myself included, where they get on this slippery slope of feeling like they just need to eliminate more and more foods, and then they'll be healed. So I oftentimes might recommend dietary templates. For example, gluten-free and dairy-free diet and soy-free diet might be a great place to start. Soy is another food that I've found to be extremely reactive for people with Hashimoto's. It can increase thyroid antibodies and anxiety for many individuals. I wish it wasn't so, but that's been my experience with it. About close to 80% of people still react to that as well. And sometimes I might advocate for a paleo diet or a grain-free diet, or, the autoimmune paleo diet has been something that's been touted as a healing diet for Hashimoto's. But where I really struggle is when people continue some of the more restrictive diets for years on end and they still don't feel good, right? I have seen that people that I've worked with personally, they're on such a restrictive diet and they have a ton of symptoms, and they're also like nervous about eating this food or even a little bit of fruit. And my goal for people is to come back to feeling their best. In some cases, one or two major food sensitivities, sometimes three, just might be something that you might deal with. There might be a big driver of inflammation in your body. But I feel like when you have more than like 3 food sensitivities or more than 3 reactive foods, then that's a big red flag for me that there's something going on with your gut. I know I've seen some different gut infections. For example, blastocystis hominis can make people sensitive to foods like grains. And then I've seen people who had carnitine deficiency that made them sensitive to dairy products. And I've also seen people who had a candida or a mold overgrowth in their guts, and that actually caused them to be sensitive to oxalates, and various infections can make people sensitive to histamines. So I know there's a lot of healing diets out there, and I love that there are a lot of healing diets, but really looking at the person as a whole, I'm always thinking about like, how do we support you to eat the most diverse diet? Of course, I don't want you to, as a healthcare professional, I'm not recommending that you eat McDonald's every day or something really toxic. But overall, a lot of, some of my clients have been people that are eating the standard American diet and they go off of gluten and dairy and maybe soy, and their life just transforms and they feel so much better. Hashimoto's goes into remission and, everybody's happy, amazing. And they go on to eat more organic and clean. But I also have clients who kind of come from that organic and clean background, and they just keep eliminating more foods. Everything is organic, and they get stuck where they're like, I'm just not getting better. And in that case, a lot of times it's like, we really need to look at the gut microbiome and what's going on in your body. So I'll be sharing more about various root causes and things we want to address and perhaps peel back the layers of the onion with Hashimoto's. Again, if you're like on standard American diet, sometimes just going off of gluten and dairy and soy can be the magic. But if you're somebody that is stuck, I do encourage you to look deeper. Sometimes it could be a temporary elimination of more foods. But if you're on a very restrictive diet and everything is causing you digestive symptoms and inflammation, or you're still not feeling good and you've been gluten, dairy, soy free for 30, 60, 90 days, then let's look deeper. My books, Hashimoto's Food Pharmacology, is a really, really great book that focuses on digestion and nutrient deficiencies and nutrition. It has over 100 recipes that are gluten, dairy, and soy free, some paleo recipes, some autoimmune paleo recipes. And I also talk about blood sugar balance, and I also talk about digestion. So part of the reason why we might not be utilizing our foods properly or reacting to them could be a lack of digestive enzymes, for example. And there's a lot of times people might have symptoms that are continually going on with Hashimoto's because they're nutrient deficient. And some of the healing diets can also cause nutrient depletions. So hopefully this episode gave you a little bit more insight about healing diets and Hashimoto's. And I guess the bottom line is that diet absolutely can be a game changer. It's a great place to start, but in some cases, some people may need to look deeper. This has been wonderful to have you here. I'm Dr. Izabella Wentz, and I hope this conversation has been healing on your journey.